Hello there, and welcome back. This is where we left off with Johnny and Danielson facing off. But now that you can identify all the anatomical structures in radiograph, you should be able to recognize abnormalities. The biggest hint, the easiest tool you have, is symmetry. So if something is asymmetric, your eyes should be drawn to it. This may look kind of funny to us. We're used to bodies being symmetrical. For example, when you look at a panoramic radiograph, you should expect to see relative symmetry. A full mouth series of intraorals also look one side to the other, and it should be fairly symmetric. Patients are pretty symmetric most of the time, so it's surprising how often this works. Sometimes a tooth has caries on it. You look closely on the opposite side, and you'll see there's caries on the opposite tooth too. So same with periodontal disease, same with a lot of different dental conditions. So use the side that looks normal as your reference for the side that doesn't. All right, does this look normal? I'll give you a minute and take a look at this radiograph. Where is the asymmetry? What's missing? You should by now know the different anatomical structures, and hopefully your eyes are drawn to right here in the panoramic radiograph where the entire posterior right maxilla is absent. The sinus borders are completely intact on the left. You can see the nasal cavity, the zygomatic process of the maxilla. Where are all those things on this side? They're just kind of gone. They don't exist. So something very destructive happened here. You'll see this image again, but for this lecture, we're just talking about how we describe these things. All right, does this show normal anatomy? Let's look for those same things. My favorite structure, the zygomatic process of the maxilla. Intact posterior border of the maxillary sinus. Here's the maxillary tuberosity. The bone looks fairly normal here. Not uncommon to have fairly low density bone in the posterior maxilla. But then what happens here? What happens to the border of the maxillary sinus? Again, this is an ill-defined, destructive lesion with irregular borders. It loses that smooth curvature, and right here we see part of the border, but it extends outside of there. And so this is what I would define as ill-defined. Pointed out the zygomatic process still intact, so it's not quite as destructive as the last one, but you can see the focal area of bone loss has these ragged borders and it extends in an ill-defined manner. This one turned out to be lymphoma. All right, how about this one? Does this show normal anatomy compared to those two cases? Give you a second to look at that. So in this case, maybe it does look more symmetric, but let's look for those anatomical structures. Where is the floor of the maxillary sinus? In this case, on both sides, it appears to be missing. This is not a localized lesion. This is a generalized condition, something metabolic, something systemic is altering the bone everywhere, because not only in the maxilla on both sides, but you see it throughout the mandible as well. And this one happened to be hyperparathyroidism. So we've established that recognition is step one. Step two is going to be accurate description, because the description is what leads you to that accurate diagnosis. After you've described it well, then you can put on your Dr. House hat and you can start to diagnose. So the description implies all types of things about the lesion, the tissue of origin, biological behavior, prognosis, treatment options, as well as finally your differential diagnosis. And pay attention to the location of lesion. That's a big one. That's also the thing I see sometimes experienced dentists ignoring the most. Location tells you the potential tissue of origin, which tells you the type of lesion it might be. We'll spend a whole part on location because it matters that much. Now, traditionally, I don't like to use a lot of acronyms, but I'm kind of softening in that regard, and I've kind of redone this whole course to use several acronyms. But this one I've used from the beginning, and this is one I call LESIONS acronym. There are 7 letters, one for each thing that you need to describe. So L is for localization, meaning where is the lesion in relation to teeth, in relation to the inferior alveolar canal, in relation to the maxillary sinus. We'll spend a whole section on this. E is for external or the periphery. Is it well-defined or is it ill-defined? You can get more specific than that, and we will, but let's go on for now. S is for shape, describing is it round, is it oval, cystic looking, scalloping between roots of teeth, irregular. Then I is going to be for internal, the internal structure, whether it's radiopaque or radiolucent, or is it mixed? And if it is mixed, then you can get really specific. The type of pattern of mix, whether it's ground glass, cotton wool, soap bubble, tennis racket, some of those are very specific to types of lesions, and we'll get to those. O is for other or effect on other structures, on adjacent structures. And this is the one where I see people miss the most. Is the lesion displacing teeth? Is it displacing the inferior alveolar canal? Is it resorbing roots? Is it expanding bone or destroying bone? So that tells you about the behavior. N is for the number, solitary, or is it multifocal, or is it multiple? Sometimes this is just implied by saying a lesion, which suggests solitary. But if there are multiple lesions, you have to say so, and then you can get more specific about where those lesions are and how it presents. And then S, the second S is for size, just so we don't forget to cover the size. That's pretty self-explanatory. In your description of location, you can either give actual measurements or say it extends from the canine to the first molar, or you can just say it's 3 centimeters in diameter. So 7 letters, 7 things. If you go through all of them every time, then you make sure not to leave anything out. And for my students, you're going to get a worksheet that looks like a Mad Lib, if you're familiar with those from the 80s. When I was in elementary school, those were a big thing. You fill in the blank with a noun, adjective, and you're going to fill in the lesions letters with the descriptions that fit. So practice with that worksheet and then practice without it. In the next part, we're going to dive into the first letter, location. It's the single biggest discriminator you have. And so there's a real reason real estate agents say location, location, location. And I'll see you on the next one. Thanks again.